Hello everyone, this is Professor Nassar. Thanks for tuning in. Today we are going to cover the general anatomy of the GI tract. After going through this video, you may also want to view some other videos that I've posted on related topics. I have one on the gross anatomy of the stomach, a video covering the gross anatomy of the pancreas, liver, and gallbladder, another video covering the anatomy of the greater omentum, lesser omentum, and dorsal mesentery, and finally a video covering the anatomy of the lower GI tract. As before, as we go through this, I will be sticking to the terms listed in your lab handout, i.e. this. And I would suggest you have that handy as well as your textbook or ebook open to the relevant sections so that you can follow along. Okay, so let's begin. Here we start by looking at a sagittal section of the head. And first they want you to find the lips. Then the oral vestibule, which is here, the space between the lips and the teeth. Next, the hard palate, supported by the maxillary and palatine bones, starts here and then goes back to here. After this, we have the soft palate, which is not supported by bone, shown here. At the distal end of the soft palate is this little grape-like structure called the uvula. It's Latin for little grape. The ULA at the end of uvula is a diminutive. Those of you who speak Spanish also know, of course, that the Spanish word for grape is uva. And uvula and uva, of course, have the same root. In the oral cavity, we find the tongue. And what separates the oral cavity from the oropharynx behind it is this space here, this archway, that is known as, or the space between the archway that's called the fauces, or the isthmus of the fauces. Next, they want you to find the salivary glands, but they note that the salivary glands are not found on this model, so we can move on to the pharynx. Recall the pharynx has 3 subdivisions associated with it, and each subdivision is basically behind something else. So the nasopharynx is posterior to the nasal cavity. What separates these two regions is again a space that's found right about here, at about the junction between your hard palate and your soft palate, but superior to that. And that space is called it goes by a couple of different names, either the posterior nares or the posterior nasal apertures, or some textbooks will refer to this space as the choanae. The nasopharynx, the inferior boundary is about here at the end of the soft palate at the uvula, and then we move into the oropharynx, which is posterior to the oral cavity. And again, what separates the oropharynx from the oral cavity is your isthmus of the fauces. The oropharynx goes down here till we get to about the epiglottis, and then distally from there we move from the transition from the oropharynx to the laryngopharynx. And again, the laryngopharynx is posterior to the larynx. And the lower boundary for the laryngopharynx is roughly at about the same level as where we get to the inferior or bottom part of the cricoid cartilage, roughly about there. And from there, this tube, the laryngopharynx, continues distally as the esophagus. Okay, next we'll move on to the organs of the upper GI. If you'll just bear with me for a second, I have to move the camera. So I apologize for any shakiness here as we move to the next section. There we go. All right, so let's see what we can see here. Here is the stomach. The part where the esophagus meets the stomach is the cardia or cardiac region. This region of the stomach, the blind pouch here, is called the fundus. This region is called the body. You notice here how the stomach then has a bend to it. And this part from here to here is the distal end of the stomach, known as the pyloric region or the pylorus. And it ends at the pyloric sphincter. Features of the stomach include this outer curve, which is called the greater curvature, and attached to this is going to be the greater omentum, part of your dorsal mesentery. On the inner curve, this this is called the lesser curvature, and attached to this is the lesser omentum. The lesser omentum will continue in sort of this direction and also envelop the liver. Inside of the stomach are these folds that we call rugae. And again, these are permanent folds. I'm sorry, these are temporary folds, excuse me. The permanent folds are here. These are temporary folds, and these disappear when the stomach distends and fills with food. By disappear, we mean that as the stomach expands, these folds basically flatten out. So these are rugae. These are the temporary folds that disappear when the stomach distends. Below the stomach, you can see part of the pancreas. It's a bit obscured by the stomach and also the transverse colon here, and also our camera view, but let's just see what we can see from this perspective. This organ here in purple is the spleen, and then the pancreas has the following regions. There's the tail of the pancreas that attaches to the spleen. This is the body of the pancreas. The neck of the pancreas is roughly about here, where you can see the common bile duct coming in. Sort of sits, the neck of the pancreas sits sort of behind this, or it sort of incorporates this. And then the head of the pancreas is really, much of it is covered here by this mesentery. It would be sort of running along, nestled in with this part of the duodenum that would curve under here. The pancreas has a major duct that drains through it that's just called the pancreatic duct, and again this drains pancreatic juice from the acini and drains it into the duodenum. Also coming in here through here in green is going to be your common bile duct. This drains bile from the liver and the gallbladder. The pancreatic duct and the common bile duct drain together out a common exit that's known as the duodenal papilla, and that is the common opening for the pancreatic duct and the common bile duct as these juices go into the duodenum. Okay, next let's talk about the lobes of the liver. From the superior side, we can see there's a right lobe, a left lobe, and then separating the right and the left lobe is a ligament here that's called the falciform ligament. This is a remnant of the ventral mesentery that regresses. From the inferior side, it's a bit hard to get the perspective here, so I'm going to move the camera for a moment. Again, please excuse the shakiness, and just adjust the view here so we can get a little better perspective. Something like this. I apologize, please excuse the shakiness. So let's go through the parts of the liver and the biliary system. Again, we can see the right lobe of the liver. This is your gallbladder. This lobe between the gallbladder and this ligament here is the quadrate lobe. This is the left lobe of the liver, and the quadrate lobe and the left lobe of the liver are separated by the second of the two ligaments that's called the round ligament of the liver. This is the remnant of the umbilical vein. The round ligament of the liver is shown here in silver. If you follow it up and over to the superior side, you'll see it basically continues with the falciform ligament. So this is falciform, and then when we come in on the underside here, we can see the round. Left lobe, and then down here is going to be the caudate lobe, this skinny lobe that we see sort of going right down, up and down in this direction. So caudate, left, round ligament, falciform ligament on the superior surface, quadrate lobe, gallbladder, right lobe. This area where all the vessels and structures are coming in is called the hilum or the hilus. And then we have the following ductwork draining out. From the gallbladder, we have the cystic duct shown here. Then draining out from the liver are your hepatic ducts, shown here. There's one here and another here. These join together to form a short section called the common hepatic duct. And then the common hepatic duct and the cystic duct join together and form the common bile duct, which starts here goes down this way, and then continues down here, joining up with the pancreatic duct to drain via the duodenal papilla into the duodenum. Okay, next let's look at the lower GI. I'm going to move the camera again. I apologize for the shakiness. Okay, recall that the small intestine is divided into 3 subdivisions. The first subdivision is the duodenum up here. The second subdivision is the jejunum, and then the third subdivision is the ileum down here. The dividing line between the jejunum and the ileum is not so easy to see grossly, and so by convention, or at least how I am saying to one way to do it, your anatomy instructor might have a different opinion, and so it would be best to ask them for his or her opinion on this matter. But in general, by the convention that I would generally encourage you to use is basically anything from about here, from basically superior to this stick, from here to here, we would call the jejunum, and everything basically below this, from here down, you would call, of the small intestine, you would call the ileum. Grossly, it's not so easy to distinguish one from the other. The other feature to note is that while the stomach has rugae that are temporary folds, the small intestine also has folds within them, and these are called circular folds, and these folds are permanent folds, as opposed to the rugae, which are temporary folds. The text also asks you to look for mesentery. Again, there's not much mesentery that is shown on this model. We go through mesentery on some of the other models where it's shown a little more, where it appears a little better. The only mesentery we see is sort of some of the mesentery just up here that's attaching around the transverse colon. So the ileum continues along here, and then finally the ileum will drain into the chyme in the ileum will then drain into the large intestine, which is shown here. The boundary between the ileum and the large intestine is yet another sphincter that's called the ileocecal valve, or the ileocecal sphincter, which is shown here. From there, substances move from the small intestine to the large intestine. So let's go through the parts of the large intestine next. Down here is the vermiform appendix. Then this chamber here, which connects to the ileum, is called the cecum. And from here we go to the various parts of the colon. So moving up the right side, food is going to ascend up here through the ascending colon. Then there's a turn or a flexure as the colon moves from the right side of your body to the left side of your abdominal cavity. This part is called the transverse colon. Then as the colon makes another turn or bend or flexure and then goes down the left side of your abdominal cavity as what's called the descending colon. And then the descending colon turns into the sigmoid colon, but the sigmoid colon is not so easy to view on this model. In part because, again, it's rather three-dimensional. In real life, the sigmoid colon is rather three-dimensional, and this model is not as three-dimensional, so it's not so easy to view the sigmoid colon on this model. I show it for you on some of the other videos where it appears a little better, a little more easily. But if you were to if I was pushed to say where is the sigmoid colon, it basically starts right about there, and then sort of goes in and makes this sort of S-shaped bend, and the end of it is right about here. The sigmoid colon then continues to this structure, which is called the rectum. It starts up here and goes down to about there. Rectum. And then the last part is the anus, or the anal canal, which is here. And again, the anal canal is surrounded by two sets of sphincters. The inner set of sphincters is called the internal anal sphincter, shown here. It's essentially a continuation of the muscularis externa, the smooth muscle that makes up part of one of the tunics of your wall of your GI. This is the internal anal sphincter, and it's under involuntary control. Then you have skeletal muscle on the outside of that, which is under voluntary control and makes up the external anal sphincter, shown here and here. The other structure I wanted to point out to you are these structures that you can see here, some features on the large colon, on the large intestine. The first is, if you notice, the large intestine, unlike the small intestine, which has a relatively smooth external appearance to it, the large intestine is sort of divided up into these smaller, what look like pouches. And each pouch or each sac, you can see one here, here, and here. Each pouch or sac is called a haustra. Each sac is called a haustrum, that's singular, and plural is haustra. Each haustrum is separated from one another by this little fold that you can see here and here and here, these sort of semicircular folds. The formal or anatomical term for each of these folds is called a plicae semilunaris. Plicae is basically just anatomies for fold, and semilunaris refers to the fact that it sort of has a half-moon shape or a semilunar shape. So these are the plicae, and each one of these is a haustrum. The plicae are formed by, they are basically constrictions of the inner circular layer of your muscularis externa, and they separate one haustrum from another. The last feature to note on here is this ribbon-like structure that's running parallel to the length of your large intestine, and this ribbon-like structure is called the tinea coli. Again, this is also a constriction of smooth muscle, except in this case it's a constriction of the outer longitudinal layer of your muscularis externa, and this essentially runs along the length of your large intestine. There are actually 3 of these bands, but we only sort of easily see one of them here. Okay, and that's it for the general features of the gross anatomy of the GI tract. Thank you for joining me. I hope you find it helpful, and good luck in your studies. Bye-bye.